This section is about maintaining your health in the United States. Health insurance is mandatory at OJC. Why, you might ask? The reason is that accidents happen, and U.S. medical costs can be very high without insurance. A broken bone can mean a medical bill that might prevent you from continuing your education. If you currently have your own insurance and are wanting a waiver, you need to bring a copy of your insurance card and the minimum coverage information to my office during orientation or within the first week. Please note that we will enroll you in the school recommended policies outlined in the email previously sent to you, also copied in this module. This is for 9 months of coverage. After that, you will not be covered and you will need to renew or purchase other insurance to cover you over the summer. If you want to retain coverage for over the summer, come and talk to me and we'll work it out. Now let's move on to your physical health. If you get a cold or the flu and you need to see a doctor, but it's not an emergency, the best option will likely be one of the family practices or valley-wide clinic located within a few blocks from school. Please make sure you bring your insurance card and the co-payment with you to your appointment. They can treat you for a variety of concerns and will help process the payment through your insurance company. If you select to purchase insurance through the school, please understand that there is a co-pay at the doctor's office. This will be higher if it's at the emergency room at the hospital. This means that you must pay the co-pay amount at the time of service. After this, they will bill the insurance company. The insurance company may not pay the full amount of the remaining bill. Often, it pays 80% and the student pays 20% as it shifts to a coinsurance up to like $3,000. If you need help making an appointment, come to the international office and we will assist you. Keep in mind that we're not your personal secretaries, so we will not make an appointment for you, but we will be there to help guide you and answer questions. Talking in English on the phone can be a challenge when your native language is in English, or if you have an accent. The doctor's offices are close to the school, but if you can't walk or would rather have someone accompany you, let me know and we'll do our best to help you. If you prefer, you can also check into getting a family doctor. When you go to a clinic like Valleywide, you may be seen by one of the doctors on schedule that day. Having a family doctor, your appointments will be with that doctor. Dr. Book's office, for example, is one that's close by that a lot of students use. There may also be an occasion for you to see a specialist, like an optometrist, an eye doctor, or a dentist, a teeth doctor. If you're having difficulty, please come in and talk to me so we can help point you in the right direction. Most international health insurance plans do not cover dental or eye exams unless it's an emergency situation, but the costs are generally reasonable. For labs and emergencies, the Arkansas Valley Regional Medical Center will likely service your needs. Before we go further, let's talk about emergency and non-emergency care in the U.S. If you have a serious issue or concern that simply can't wait, you will need to go to the emergency room at the hospital. But this can be expensive, so I want to point out some good reasons to go and some not very good reasons to go. Consider this situation. You're at the tennis courts playing tennis with friends. You trip and fall and scrape your knees and twist your ankle. But it doesn't seem broken, do you? 1. Immediately go to the emergency room. 2. Ask your friends to get you back to your room. Wash out any scrapes and ask your friends to get some ice and a towel. Put your foot up on a pillow and put the ice towel on it for 15 minutes. The answer is 2. The scrapes will heal, and the ice will help any swelling on your ankle from twisting it go down. If it's still sore in the morning, call a family practice or Valleywide clinic to make an appointment to see the doctor. Here's another. You're at the park and you get stung by a bee. 1. You're allergic to bees. You're starting to feel short of breath and you do not have an EpiPen. Call 911 for an ambulance. 2. You're not allergic, so you grab some cold water and you try to get the stinger out. Stay calm and then go back to having fun. The answer? Both are correct. If you're one of the unfortunate few that have a serious allergy to bees, your throat can swell and make it hard for you to breathe very, very quickly. Call 911 and get help immediately. If you are not allergic, however, it's not as serious for you. It's good to get the stinger out, wash out the sting. It'll itch and it'll swell at the site, but the pain should disappear within a couple of hours. Now, there's clearly some situational circumstances that'll change things. For example, if in the first scenario you tripped and fell and a bone is now sticking out of your leg, you know it's broken. I would call that a major injury. Go to the emergency room. If for any reason you go to the emergency room, please call me or call Cullen. You will receive our phone numbers when you arrive. One of us will join you at the hospital and make sure that you're okay and help you through. You do not have to go through this alone. Finally, a big part of staying healthy is to get regular exercise. The fitness center has all kinds of great exercise equipment as well as racquetball courts. If you enjoy swimming, you can also go to the La Junta High School pool and swim during any public swim session for free. You just need to bring your student ID and sign in at the door. Eating right, maintaining a good sleeping schedule, and staying fit can go a long way to keeping you healthy throughout your time at OJC.